Tonight we have learned a freelance American journalist working in Liberia for the last 3 years has tested positive for Ebola. The photojournalist and writer was part of an NBC News team covering the Ebola outbreak in West Africa.
While Thomas Eric Duncan, who just flew to DFW Airport last month from Liberia, remains in isolation tonight at Texas Presbyterian Hospital. NBC's Jay Gray has the very latest from Dallas.
The freelance photojournalist and writer was working with NBC News chief medical editor and correspondent Dr. Nancy Snyderman when he tested positive for Ebola.
This is a very experienced photojournalist who we hired to augment our team on the field in Monrovia.
Snyderman has been in West Africa with 3 other NBC News employees covering the Ebola outbreak. No one else on the team has shown any signs of contracting the deadly virus.
We have really worked hard to minimize our risk. I mean, obviously, zero risk means never coming to Liberia. Minimal risk means crossing over into this country.
The freelance photographer is being flown back to the States for treatment. Dr. Snyderman and her crew will also come back on a private jet and immediately place themselves in isolation for the next 21 days.
The rest of my team, very healthy. We have been extraordinarily vigilant, but we are obviously very respectful of this virus, which has killed so many West Africans.
Back in Dallas, Thomas Eric Duncan, the first patient to be diagnosed with Ebola in the U.S., remains in quarantine inside this hospital where doctors say he's in serious but stable condition, while public health teams continue their search for anyone who may have had contact with him.
There's a list of about 100 what we call potential or possible contacts, and that will be culled down to a list that will begin the contact tracing on.
One more weapon in the ongoing battle to prevent the spread of the deadly disease. Jay Gray, NBC News, Dallas.
4 family members of the Ebola patient being treated in Dallas have been ordered to stay in the apartment where they live. Texas health officials say they issued a state order to quarantine them because they were not complying with a request to stay inside. After leaving once, law enforcement has been posted outside to make sure they do not leave again. Eric Duncan stayed at this apartment before he was hospitalized. The owner of the complex says the family inside is safe.
Nobody is supposed to go inside the apartment. They are in their apartment. They cannot come out. They are not even allowed to come on the porch. CDC is communicating with them. They are going there. They are monitoring them every day, couple of hours, couple of times.
That family in Dallas will be monitored for 21 days, and food and supplies are being brought to them. The CDC and the state of Texas and local health officials have set up a war room in Dallas. They are trying to track down anyone else who may have come in close contact with the Ebola patient. Health officials want to emphasize that right now this is just a precaution.
The only person who had symptoms is Mr. Duncan, who's in the hospital, and no one who has been around Mr. Duncan during the time that he has been symptomatic has shown any indication of having contracted Ebola.
And for the first time, we are hearing from Eric Duncan's family. His mother lives just outside of Charlotte, North Carolina. His nephews say this is the first time he ever came to the United States. They say Eric wanted to see his son graduate.
I pray for you to get well, for me to see you. My whole thinking is on you.
And Eric doesn't want to die. You know, I know he loves life, and he's an outgoing person. He's a very, very kind-hearted person, always willing to help people. So for this to happen to him is sad.
The Liberian government says it will pursue criminal charges against Duncan because he lied on a form before traveling. Government officials say Duncan said he had not come in contact with anyone who had Ebola. And the State Senate Committee on Health and Human Services will meet in Austin this coming Tuesday. The information hearing will be to find out what the star of public health and safety is, the status of public health and safety is. It is important to note that the CDC says Ebola is not an airborne virus. And remember, this form of Ebola can only transfer after someone shows symptoms through bodily fluids. We have in-depth coverage on Ebola at our website, KXAN.com, including the latest developments as well as the symptoms, how this disease spreads, and why health officials say they are confident they will be able to prevent Ebola from spreading further across the U.S.